What medication do you take?
Well, the acyclovir, or its newer cousin valacyclovir, Valtrex was the brand name of that, and
So Valtrex.
those are the medications generally given for shingles.
Why do you give Valtrex? Why do you need to do it immediately? Why can't you wait 5 or 10 days, make sure what it is, and just see if it goes away on its own? Why do you want quick treatment?
Well, the virus replicates in the first 3 days, so the rash is on the uptick, and by the time you hit to 3 days, it's pretty much done that, and then it's just that long course down. So you have to stop it on the way up to really make a difference in how well how quickly you get over the shingles.
So the Valtrex, if you find it early and you use it quickly and you use it early, does it keep you from getting problems later on?
We think somewhat. Those are hard studies to perform, and I think what we're referring to is a condition called post-herpetic neuralgia.
Post-herpetic neuralgia. That means after herpes pain.
About a third of people over 50 will get shingles if they do not take the vaccine, which we'll talk about in a bit. And of those people who do develop the rash, 20% of them will go on to have pain after the rash is over. So it's normal to continue to have symptoms of discomfort in the area where one's had shingles for up to a month, 4 to 6 weeks after the blisters have dried up and fairly well healed. But in about 20% of people, they can continue to have pain in the area where they had shingles, and it can really be a problem.
Somebody told me that the after shingles pain, the post-herpetic neuralgia, if you get that, it's like you want to go to the bridge and jump off because the pain is severe.
Well, it varies, but it certainly can be very uncomfortable. There are treatments for it, but it's absolutely one of those things that is much better prevented than treated.
So the Valtrex will help decrease the incidence of after shingles pain?
By somewhat.
By somewhat. It doesn't guarantee it, but take it, it's worthwhile taking it so that you don't, taking the Valtrex,
Correct.
So that you won't get the post-herpetic neuralgia.
Correct.
So if you've taken Valtrex and you do get post-herpetic neuralgia, what can you do something for that?
Sure. There are simple things like lidocaine creams and lidocaine patches.
So that would be a local anesthetic. Lidocaine, they got a patch for it?
They do have a patch.
You can put it on, takes the pain away?
Absolutely, very helpful, because remember that shingles is an infection of the nerve, and so that's why it can be so painful, and when it damages the nerve, that's why we have that persistent pain. So things that help calm nerve pain are what are helpful. So certainly things like lidocaine. And then probably the thing that is used the most is gabapentin, which used to be Neurontin, or its newer strength cousin Lyrica. Those are medications that are specifically for neurologic pain, and that's what we usually see used in post-herpetic neuralgia.